Going to present the survey itself, give an introduction for it. My name is Suvi Karoranga and I work in IDF as an epidemiology manager. Next 10 minutes we are going to hear the interim results from our colleague from Leicester University, and 10 minutes we are going to have the presentation of the toolkit and supporting material for this survey data collection. 10 minutes we are going to have interview of our colleague Charlotte Rosen from Diabetesforeningen, the Danish Diabetes Association, and the last 20 minutes we are going to have a Q&A. To start with the key messages of the survey, the Taking Diabetes to Heart is a first-of-a-kind survey, online survey for people with type 2 diabetes, aiming to give important insights about people with type 2 diabetes and their awareness of CVD risk. To give a little bit of background, the cardiovascular disease consists, for instance, of stroke, coronary heart disease and peripheral artery disease, and is the most common cause of death in people with type 2 diabetes globally. And people with type 2 diabetes are 2 to 6 times more likely to die from CVD, including heart attack and stroke. And despite this, people with type 2 diabetes have a low awareness of their risk of CVD as a serious complication of type 2 diabetes. The aims of this survey is basically to define the actions that are required to promote the knowledge and awareness of CVD risk among people with type 2 diabetes. It aims to improve health and well-being, identify current gaps in education and CVD risk behavior among people with type 2 diabetes, and it aims to address systemic challenges in healthcare systems. The outcomes are to facilitate the transfer of knowledge from the communities to the clinical setting, strengthen the preparedness for increasing prevalence of CVD at the population level, particularly among high-risk groups, and thirdly, use real-world data for the purpose of assessing the effectiveness of cardiovascular disease information currently available. Some key facts about this survey. The data collection is 6 months in total, and we are now halfway because it began in September. It has 27 questions. It is open for everyone with type 2 diabetes. It is available in multiple languages. Currently, almost 20 of them are already online. So far, people from 32 countries have participated to this survey, and the full results will be presented in the second half of 2018. A little bit about the timeline. The data collection began on World Heart Day 2017. The presentation of the interim results is taking place right now, and the data collection is supposed to close in March 2018. We aim to present the global results in EASD in September 2018, and we hope to launch the report in October 2018. The survey covers various topics. They are divided to different categories. Here are the main ones. Firstly, knowledge of CVD risk. Secondly, awareness of CVD risk. Thirdly, the information received from healthcare practitioners. Fourthly, association of type 2 diabetes and cardiovascular disease. And finally, the different information sources. Now I'm going to invite Dr. Nafisa Dalwani to give us an overview of the interim results that we have received so far.
Thank you, Suvi. So I'll be taking you over some of the interim results that we have so far. So we've had 943 responses from 32 countries so far, and as you can see, yeah, my laser's working. As you can see, about 83% of these responses have been from Denmark, about 6% from the US, 4.5% from Belgium, 1.4% from the UK, and then the rest of the countries we've received less than 1% responses. And although we have a majority of population here from Denmark, if you see the results on the next few slides, you'll see that they're still very similar to the global estimates. What we've done is we've analyzed Denmark separately because obviously there was a larger chunk of population from Denmark. So this slide shows the age and gender distribution in terms of all the other countries versus Denmark. What we can see is the most of the responses were received in the age group of 60 to 69 years. And also what's interesting is that in the younger age group, so from 20 years to about 59 years, we see more females responding and less males responding. But over the age of 60, we actually see more males responding compared to females. And that pattern was actually consistent if we look at Denmark separately. So one of the questions we asked people was, when do people with diabetes learn about cardiovascular disease? And again, we've analyzed global results separately and Denmark separately. So the good news is that about 52% of people said that they actually learn about cardiovascular disease before the diagnosis of type 2 diabetes. And we see that it was very similar in Denmark. But about 12% of people here said that they never learn about cardiovascular disease when, if they have type 2 diabetes. Also, what's interesting is that about 7%, 67% people report that they only learn about cardiovascular disease when they actually get diagnosed with cardiovascular disease. And then some people, about 14% globally, and then about 5% in Denmark said that they only learn about cardiovascular disease actually several years after cardiovascular disease diagnosis. So we see that this is a problem and we need to move this timeline forward. So we asked people, what are cardiovascular diseases according to people? Which ones did they think were actually cardiovascular diseases? So about 80% of people thought that heart attack was a cardiovascular disease. About 70% thought hypertension was a cardiovascular disease. Interestingly, similar proportion of people thought thrombosis was a cardiovascular disease. And the proportions for actually atherosclerosis, chest pain, and arrhythmia were actually quite higher as well. Stroke was just about 50%, as you can see, and so was heart failure. But when you start looking at some of the others, so aortic aneurysm was less than 50%, brain hemorrhage less than 50%. Interesting enough is kidney disease, because that's a very common complication, so closely linked to cardiovascular disease and also diabetes. Not even 20% of people thought that that was actually a cardiovascular disease. So one of the other questions we asked people was, which cardiovascular disease risk factors were people aware of? And the proportions for obesity, smoking, high blood pressure, high cholesterol, physical activity, diet containing high amounts of saturated trans fat, family history of diabetes, uncontrolled blood sugar, high stress, these were quite, people actually recognized them. But what less people recognized was excessive drinking, which was about 60%. And then more than 5 years of living with diabetes, people didn't identify that as one of the risk factors for getting any cardiovascular disease. Also, age wasn't identified by a lot of people in the survey. And interestingly, depression was only identified in around 30% people. We then asked people to rank their own cardiovascular disease risk. And what we saw is that 5% of people globally, and similar in Denmark, actually ranked their risk of cardiovascular disease to only be marginal. 22% people globally thought their risk was minor. And it was very similar in Denmark as well. About 40%, just less than 40% people thought their risk was moderate. So the good thing is that people are identifying that their risk is sort of moderate, major, and severe, but we need to make people more aware who are actually ranking their risk here, that their risk is actually higher than what they assume to be. The next question was, which cardiovascular events people with diabetes have experienced? About 50% of people with diabetes actually had hypertension. Less than 20% people had angina, just over 10% with arrhythmia, and then the rates go down. So for atherosclerosis, heart attack, thrombosis, it was just around 5%, and then for heart failure it was about 2%, similar for stroke, and then brain hemorrhage, aortic aneurysm, which are sort of more severe, these were experienced by only about 1% people. Number of cardiovascular events per person with diabetes. So 40%, around 40% of the people said that they had experienced only one cardiovascular event, and it was very similar in Denmark again. About just over 15%, actually 16.6%, or 1 in 6 actually said that they had experienced 2 cardiovascular diseases. About 6% said they had experienced 3 cardiovascular diseases, and then for 4, 5, and 6 the proportions went down. The proportion's very low here, probably less than 1% who had experienced 7 cardiovascular diseases. One of the other questions we asked was, when do discussions about cardiovascular disease take place with healthcare professionals? And we looked at global versus Denmark again. The good news is that 27% said that they had actually discussed cardiovascular disease with their healthcare professionals. The discussion took place at the time of type 2 diabetes. About 5% said that they had actually discussed this with their healthcare professionals before the diagnosis of type 2 diabetes. So that's good news. But again, about 16% people, or 1 in 6, said that they had never discussed cardiovascular disease with their healthcare professionals. And then some people said that, less than 5% people said that they actually discussed it when they were diagnosed with cardiovascular disease. About 2% said they discussed it soon after they were diagnosed with cardiovascular disease. And similar proportions reported actually discussing it several years after they got cardiovascular disease. The last question that I'm going to discuss today is that we asked people to rank how important these factors were to reduce cardiovascular disease in people with diabetes, and they could rank it from 1 to 5. So clearly majority of the people thought 3.6 was the average rating for keeping or maintaining healthy weight, being physically more active, and control of blood glucose, eating healthy, and taking their medications. But 2.8 was the rating for reducing stress, so they didn't think reducing stress was as important as taking their medications. And also only the rating for actually stopping smoking or reducing their alcohol consumption was only 2.1, so actually they didn't consider that to be very important in the reduction of cardiovascular disease risk. So those are some of the findings that we'll be presenting today. I'm sure next year you'll all be excited to see the report and the final results. I will hand it back to Suvi to talk more about the manual and the toolkit. Thank you.
Thank you very much, Nafisa. So now I'm going to show you some of the materials that we have prepared in order for facilitate the data collection. So first of all, to explain in further detail how the data collection actually happens, we have an online survey. You can see the address here. It's www.idf.org/takingdiabetestestoheart/survey. It is available in multiple languages, currently Arabic, Bulgarian, Chinese, Danish, Dutch, English, Filipino, Finnish, French, Georgian, Germany, Hindi, Italian, Portuguese, Russian, Spanish, Swahili, and Vietnamese. And more can be added, and therefore we welcome new translations still. It takes less than 15 minutes to fill in the survey online and submit it. Who is the target population? It is the people living with type 2 diabetes. no need about CVD is needed in advance in order to answer this survey. And we aim to have 10% of the national number of people with type 2 diabetes from each country to reply to this survey. The strength of the survey relies on the amount of responses, and this is why the member associations, for instance, can play a crucial role by increasing the awareness of the survey in each country. Awareness materials are endorsed by IDF and Novo Nordisk and have been created and can be utilized in several ways. These materials can be downloaded from the website that has been created for this survey, which is www.idf.org/takingdiabetestestoheart. I'm going to show you some of them. This is the first one. It is a poster. This poster can raise awareness about the survey in many ways. It can be used, for instance, on the walls in pharmacies or GP waiting rooms or patient group meetings or bus stops even. The next one is print advert template. Unfortunately, I don't have the right size with me, but it's very similar to this leaflet. Again, it can raise awareness about this survey, and it can be placed, for instance, in newspapers or magazines. You can think about the audience in demographic when choosing which publication to use, and there are several sizes of it which you can use. So this is the sorry, I have a question here.
Are you able to change the imagery when you put different people in place?
Yes, it is possible on all of these materials to have different picture, have different logos, have different languages. Actually, we can replace the English text in another language. So we can, as the same way as the survey is translated in various languages, also the promotional material can be used in different languages. Currently, we only have it available in English and Spanish on our website, and the materials here in this Congress are in English. But we are happy to provide other pictures and translations. So how can this leaflet be used, for instance? It can be distributed to general practitioners or pharmacies as an informational material to share with patients during a visit, or for patients to pick up in a pharmacy, hospital or GP waiting room or patient group meeting. Digital version could also be added on your websites to be downloaded and accessed. And lastly, we have social media image template. It can be used as a short burst awareness raising tactic around key milestones such as World Diabetes Day or World Heart Day. The image can be placed on patient group or IDF or Novo Nordisk's own social media channels with a direct link to the survey website. We have already used it through these channels, and you can also share these messages on your social media channels. So what are the steps to take to support? If you are living with type 2 diabetes, please go online and answer the survey. If you know someone who lives with type 2 diabetes, please invite them to take the survey. You can share the link also in any university department, health clinic, etc., which might be a good source for collecting more responses. If you are active online on social media, you can promote the survey to your network by using the hashtag type2DG or TD2Heart. If the survey is not available in your local language, you can volunteer to translate it so that it can benefit the members of your community and help to achieve globally representative results. And the same goes for the other promotional material. You can share the link to the survey on your website, for instance, or add the logo and attach the link to the survey with it. What are the benefits of supporting this survey? If you represent a national organization or institution active in the field of diabetes or CVD, you can help engage people living with type 2 diabetes in your country to take the survey. We will acknowledge you as a supporter and feature your logo on our dedicated supporters website. If you provide your access to, we'll provide you access to the national report if we are able to generate one, so that depends on the amount of responses, but of course for the global report for sure. And you may have access to country insights to people with CVD risk and learn from peer colleagues. So our call to action is spread the word. We encourage you to take the survey and encourage others with type 2 diabetes to take the survey. Now we are proceeding with the agenda. We are going to hear some best practices from Denmark. Please, I'm inviting on stage Charlotte Rolfs Clausen from Diabetesforeningen, Danish Diabetes Association.
Yes. We'll help each other.
Thank you for coming, Charlotte. Would you like to introduce yourself in further detail?
Still doesn't work.
Hello? 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 Is it working? Closer? All right. Welcome, Charlotte. Would you like to introduce yourself in further detail?
Yes, thank you very much. I'm Charlotte Rolfs Clausen. I'm from the Danish Diabetes Association. I'm Director of Global Public Affairs.
So the first question I have is, how many members do you have in your organization, and how are you normally in touch with them when it comes to research?
We have approximately 90,000 members, and that is, as we are told, it's the largest amount of the compared to other countries when you compare to registered persons living with diabetes. And we are normally in touch with them both on research matters. We are in touch with them through surveys. We have a panel, and then now and then we also send out specific surveys to a larger amount, but I think I'll get back to that later on.
Thank you. So in your perspective, do you find the survey topic important, and why?
It's very important, and also from the findings already and the statements that has been, it's important because so many unfortunately die from cardiovascular diseases. Sorry, and then also because the preliminary results show us that the awareness is very low. So it's an important survey seen from our point of view.
Thank you. And how important do you consider it to be that the survey is translated into Danish, and how did you facilitate the availability of Danish translation?
I consider it very important. Even though the majority of Danes do speak English, it is very important that it is accessible in our local language. Actually, the translation was provided to us from the sponsor, and then we just went through it very quickly. So it was not too big a job for us.
For us, it is a help already that you went through the translation to validate it, that it is good language, so that we can place it online and it can be used. Did you establish any kind of strategy to facilitate the data collection?
We have an overall strategy on how to reach out to our members, but we didn't establish a specific strategy to this one, and maybe we did anyhow, because what we did was that we made it available on our social media. So we sent it out on our Facebook page, made it wrote about it and made people aware, and there we also had a link to the survey. And then what we also did was to do a short tweet, I think, on it. And the major source, I think, for our success was that we have a very good IT structure in Denmark. We have also available a large number of emails, and we have our members' support to actually we're allowed to send emails to them. So we send out an email with the survey to nearly 20,000 persons living with type 2 diabetes. And within, I think, the first 48 hours, you saw the responses. So I think that's one of the reasons why there are so many who answered from Denmark.
Thank you. And did you use any of the promotional materials that I just presented, provided by IDF and Novo Nordisk, that can be used either on printed or online?
We only used the online material. We had a link to the web page, so we didn't do any other advertising for the survey, neither in our magazine, neither in any leaflets or anything. We just did it all. We did it all online, Facebook and emails.
In principle, you have many communication channels, however, and it sounds like they can be used in many ways. During the process, when you started to advertise the survey, did you face any challenges, and how did you overcome them?
We had a technical difficulty in the beginning. People were not able to continue the answering the survey, but that was solved very quickly from your side. Apart from that, a few had comments on the language, so that was the only thing. So no, not really.
To further elaborate this, from our perspective, from IDF perspective, one lesson learned out of this is that it is not enough to only read that the text is good. It is also important to check online, once the survey is placed online, that it works correctly and it can be used in a correct way. But I have the same question for you as well. From your perspective, do you have any other lessons learned beyond this?
No, not beyond that. It would be that we should also try it out before we actually send the link out. That's the only thing. Because apart from that, everything worked perfectly.
All right. Thank you very much for coming. Do I have any questions from the audience for Charlotte?
Hi, good morning. Thank you so much and congratulations. I'm Paula from Brazil. Do you have already any actions planned with considering the insights you got from the questionnaire?
I'm not sure if the question is for me or for Charlotte, but you may start.
For now, no. But in Denmark, we do have a policy around. For instance, we've the last 2 or 3 years we've worked very closely to have a national diabetes action plan, and we actually succeeded just a few months ago. And in that plan, there is a focus on early detection and early detection of diabetes, but also early detection of complications. So we will have to follow up on that within the next 2 years, and when we get the results, we have the preliminary now, and then when we get the results later on, we'll definitely include that in our advocacy tools. And then I also have to say that you mentioned it before, that we actually do have a focus on different complications throughout the different our magazines. For instance, we have a magazine to the 90,000 members, and just 3 months ago we actually have a specific focus on heart disease. So I think that might also have helped emphasize how important this is, and actually that was not a coordinated thing with IDF, so we were just lucky. I think that might also have helped a little bit. Yeah.
From IDF's perspective, this survey aims to identify different gaps in education. Once we know those gaps, we can then consider how are we going to fill those gaps. We probably have to consider about educational materials, but also we have to consider on a bigger perspective, what can health system do, what can governments do, what can different organizations do in order to increase the awareness and the knowledge of this CVD risk among people with diabetes. But we don't have an action plan yet, and we don't have plans yet. We are going to develop them based on the results that we are going to get next year. Are there any other questions from the audience for Charlotte, me, or Dr. Nafisa Dalwani?
Thank you so much. This is very interesting survey. My question is about participants who are not computer savvy and they don't have emails or they can't access the link in developing countries and other countries. So, what do you comment about this?
I will start by answering, and the others can fill in if they have other proposals. So we have heard this question also before. What we say is that if there is a magazine, just like Charlotte said, other kind of printed materials that can be placed. For instance, we have also heard that there are some associations in China, for instance, where individual people have volunteered going to a clinic, providing a laptop, smartphone or a tablet in order to the people who come to the clinic to answer the survey. Also, one option is to print the survey itself, fill in the questions on paper and then submit them to the system once connected to the internet. But we know that it can be difficult and it can be time consuming. So these are our first recommendations, but we are looking into if we should move towards paper data collection in those areas where online data collection is very difficult.
The other question that I have is about representation from Arab countries or Middle East. I don't see any representation. So what are you going to do about this? Do you have any communication with the diabetes associations in these countries, or what's your plan?
Thank you. Again, a very good question. Yes, we have a very small number of replies so far. The data collection has been open for 2 months, and this is why we still have the data collection open and is going to continue until March, because it has been a short time to collect answers and a lot of parallel activities that have gained a lot of attention, such as World Diabetes Day or this IDF Congress. So we continue, and we have done it, to distribute information through email, for instance, to the member associations, and we will continue this. We really also look forward to different ways to collaborate with member associations and other local affiliates to facilitate us, because we are there to provide support basically from the IDF Global Office. Are there any other questions from the audience?
Is the survey considered public domain survey that other researchers can use in the future or in their research?
Thank you. Again, very good question. So it is purely voluntary and anonymous to answer to this survey. The survey is based online and individual people can access the link. It is on IDF website to go there on their own time. The IDF is the owner of the data. The database is IDF's owned, but we will analyze it and provide the report in public. So nobody else has access to the data, but for the results there will be an access. The survey itself is online. It is a link that can be accessed on IDF website, and IDF website is an online domain. So you don't need any password or any kind of Sorry, I didn't give you the microphone, but the question was if the different centers or institutions can use the survey. Basically, we invite them to share the link. So the link can be forwarded in online or via email, or placing a picture or as an advertisement on a website with a link, and then it can be information can be shared to where the link is and what the link is. I have another question.
Hi, Suvi. I think the question is, will the raw data be available for scientific researchers to take and apply and analyze elsewhere? Is that correct?
I was thinking about the survey itself. If the researcher can use the survey to collect data for their own research. That was the question.
No, the database is owned by IDF, so therefore we don't provide the access to the data itself.
And also, I think for the survey, IDF, my understanding is that for the survey itself as well, IDF owns the IP for that. So I don't think that you can use it as it is. You can probably use that as a guide to create your own, as a reference point to create your own survey or do your own research. But I don't think you can use that exact survey because IDF would hold the IP. Is that correct?
Yes, that is correct.
First I have a comment, and then afterwards I have a question to you. A comment would be on reflecting also on our success. We are an old organization. We were sort of born in 1940, and we've been through a lot of development throughout the years. We have very loyal members. We've had a development where we started with a lot of volunteers and going from that phase to becoming what we would call an interest organization working on public affairs. We then developed also focusing, would we be a broader organization, focusing for instance on lifestyle in general, or would we focus on diabetes? And we decided to focus on diabetes, people living with diabetes, relatives, and the people that do not know that they have diabetes. And now we also are in the phase of becoming not a scientific organization, but still a knowledge organization. And I'm saying this because this journey has enabled us to engage with an awful lot of different stakeholders in Denmark. So we are seen as one of the major players in diabetes, in the field of diabetes also. So I said our members are loyal, a lot of the researchers, we have a very good dialogue with them. And this is all about creating awareness about the cause, stating the burning platform, stating what this actually means both to the persons living with diabetes, but also what it means from an economical point of view. If you don't prevent, then we'll have major, and we already do have major economic burdens in our society, because people can't work, people need to go to hospitals, etc. I'm saying this because we have been able to do this kind of awareness throughout the years. We've built up loyalty in our members and with our stakeholders. So our working paradigm is that we have knowledge. Then with that knowledge we develop our political statements and we communicate them. So that is very much our working paradigm. And now I'll get back to the question, because this is of course something that we can all do. It's not that difficult to do. It's what a lot of people do, but you might need a little bit more time. But using this, I mean, we have a survey, we'll get some results, we can then, and you've already touched upon that, we can do political statements and we can communicate about that and make even more awareness about that. So the question would be, when you've had the results of the survey, do you have any idea of whether you want to do it again in 2, 3, 4 years' times? Because some of the diabetes associations and diabetes societies around the world might not have been able to work that structured with this kind of policy area. So I wondered if you have any already have any strategy for follow-up on the survey.
That is a very good question. No, we don't have a very detailed strategy yet, but it is a good point that once the awareness activities will hopefully be developed based on this survey, then evaluate if those awareness activities have gained their goal, basically. So it is something that we probably should take into consideration when we create a strategy once we have the findings. Any other comments on this question, or any other questions from the audience?
Hi, I'm Srilekha from India. Thank you for the great work you are doing and congratulations for the very new initiative. So my question is that, I think if I'm correct, it started in September 17 and ending in March 18. So why, may I know, like, why did you just put a frame of 1 year? Like, would you like to continue? I think this is just overlapping with what you recently discussed about the follow-up. So why can't be it a continuous process? Because day by day the diabetes population is increasing, the people who are diabetic, and obviously the CVD risk will be more. So why can't be this an ongoing process? Because more and more people will be knowing about this. Suppose if one person answered they have attempted the link, and they will share with a peer that this is a questionnaire, and if this is propagated that there's going to be something awareness, then more and more people will participate. So can it be an ongoing process? I don't know the behind strategy, but just this is my question.
Thank you. It's a good question again. We already see from the interim results that there is a gap in knowledge and awareness, and something needs to be done about it. So once we know where the gaps exist, and that we will know once we have more findings from different parts of the world, then it is easier for us to know what are the areas where action needs to be taken, and then we can also define the actions. So the survey is a starting point. It is the beginning for a bigger work that needs to be done.
Also, from an analysis perspective, if we need to make recommendations, we make those recommendations based on the data. So we need to put an end date for now in order to then say that these are the final results of the survey. Obviously, like Suvi said, the efforts will continue, but at that point we will know exactly what the gaps are, and then we work on those gaps, and hopefully there will be other work to follow, which will then take into account the follow-up and whether, whatever strategies different associations or countries are taking, whether those are working or not. But I think we have to put an end date, because there needs to be, that's the point where we do the final analysis. So there needs to be sort of a date.
Do we have any more questions? All right, thank you everyone for coming, so numerous and with so many good questions. All right, I have one more question.
Given that the data is quite heavily skewed towards Denmark at the moment, Do you expect the totality of the final study to show a similar trend, or do you just not know at this stage?
This survey is global, and Denmark represents the high-income countries. We don't know if they are a good example of the whole globe, and probably not, because there are so many variables that affect to people's knowledge. One of the background questions that we have for people is, for instance, their education, their age, the country where they come from, so that perhaps those things also affect to the awareness. But we haven't done any analysis further with these things yet, and we haven't been able to, because we are not able to compare Denmark to any specific country yet. So we are curious to see if the trend will be the same, similar in Denmark than in other parts of the world. It is hard to project it.
Going back to your question, I think like Suvi showed all the promotional materials, and obviously, you know, we're publicizing it at the conference. She talked about all the strategies that we're putting in place to increase responses. So I'm hoping that when we have the final results, they would actually not be skewed by Denmark, and we all hope that it would actually be a true global picture. And like you said, you know, with Middle East and stuff, we hope that you all came to the presentation today, you will actually publicize this and actually make people realize that this is important. You'll take back the promotional materials and encourage your own countries and member associations to participate. So yes, we hope for a better global picture next year.
And Siv, you've said one of the key barriers and what has been discussed so far is access to technology in some parts of the world. What have been the other common barriers to getting this running, and what would your advice be to people here who might be considering implementing this survey in their country?
Firstly, as we discussed with Charlotte, making the survey available in different languages helps the people in certain parts of the world to answer. It is always easier to answer in your own language. And secondly, once the survey is translated and online, if not needed the translation, still it needs to be advertised. So for people to know about the survey, it is available, but is it to know that it is available? So therefore we need everyone to advertise about it, to share it with their networks, because it is like a snowball effect. When shared with a network, it is seen by a bigger audience, who again can share it with their network.
Maybe just a short reflection, because you need to use the momentum, and as I also mentioned, I think that the majority of the answers from Denmark, they were within the 48 hours after receiving the email. So if you have some kind of awareness campaign, make sure you are visible wherever people are, pharmacies, workplaces, wherever you want to do this. But I think you have to create a momentum, and then you come with something that they can't say no, and they have to answer, because it's very important for them. And you have, of course, to state also that it's important for them afterwards that they answer.
And to further continue this thought, the data collection in principle can sound either a short or a long time, depending on if we've reached the right channels where the people can actually get to know about this survey. Then it can happen in one day, like it happened in Denmark. All right, thank you again everyone for coming. The session has been live streamed and recorded, and it will be available afterwards as well. So it can also be used as a way to inform different audiences. Thank you again.
Thank you.
It is very helpful for the others to have an example.
It's, yeah, and I mean, even if it's very different conditions we have, and I totally acknowledge that, then just the dynamic